Garrett, thanks. Well, throughout this whole entire pandemic, we have been welcoming medical professionals to answer your questions about the coronavirus. If you'd like to ask a question, text the number on your screen. Don't call that number down there. Text it 479-785-5055. We're joined today by Dr. Patrick McGowan with MANA of Northwest Arkansas. Dr. McGowan, thank you so much for being with us this afternoon. We know we have focused on, and there's been a lot of focus on how this is having an impact on those who work on the front line, the doctors and the nurses. How have you and your colleagues held up so far?
Well, I would say, first of all, that I'm as a family medicine doctor and working in the outpatient setting or working in the community, we're not quite on the first line or on the front line yet. So for my colleagues, my doctor colleagues and our nurse colleagues and all the other crew that work in the hospital, right now we're kind of like the general public. We're there supporting them. But me personally, and for a lot of our physicians out there in Northwest Arkansas, we have not necessarily been treating COVID face-to-face quite yet.
Still a lot of support for those doctors and nurses, no doubt about that.
Absolutely, absolutely.
All right, a couple of questions we can get to from viewers. If a patient tests positive for coronavirus, what's the next step? What happens next?
Sure. Well, depending on their symptoms, assuming that their symptoms are mild or not requiring a hospitalization, the recommendation right now is to go home and shelter in place or quarantine, as we've been saying. The recommendation for that is 14 days. Obviously following up with their primary care doctor and paying close attention to their symptoms and having a medical professional monitor them is beneficial. But that's the first step if they're not requiring hospitalization. As
far as testing is concerned, we did get one question on this. What is the process of a test, and why are some people getting those results back in a couple of days while others have to wait a week or so to get it back?
Right, we're getting a lot of those questions too. An excellent question. The process is there's a lot of testing centers. I say a lot. There's a few more now than there were a week or even 2 weeks ago available to the public. It's a nasal swab. We've maybe heard a lot about the discomfort of the test, but right now you have to meet certain qualifications, having certain symptoms, namely either being above the age of 65, having comorbid conditions, having symptoms, or being directly exposed to someone who has a positive test. Remind me the second part of your question there?
And some are getting it back in a couple of days. Sure. Others have to wait a week or so.
It really depends on the lab. They're going to different labs. Those labs are getting different volumes of tests. They cannot run an indefinite number of tests at the same time. So a lot of it is dependent upon which lab your test goes to and how many other tests that lab is trying to process at that time.
All right, and then one other question before we take a break. Who should be hospitalized for the coronavirus? At what point does that happen?
Well, again, speaking with a medical professional, they're going to run you through a series of questions or evaluation to determine your need for inpatient or hospitalized care. Typically, it's those people that are having extreme chest pressure, difficulty breathing, are becoming a little lucid or not all that, together, or if they're not oxygenating themselves with this respiratory disease.
And typically those are the ones that are either elderly or have some kind of underlying issue already. Is that right?
Well, we're certainly seeing that this disease is affecting elderly and people with certain comorbid conditions more than the general population. But it is not selective in who it infects, and it's not necessarily selective in who experiences severe symptoms.
Right. All right. Dr. Patrick McGowan joining us from MANA. We'll have more questions coming up right after the break. All right, welcome back. We are joined by Dr. Patrick McGowan with MANA of Northwest Arkansas to answer your text-in questions to 479-785-5055. Dr. McGowan, thanks again for joining us. I think I may know the answer to this before I even ask, but a viewer has sent in, should infected people continue to be in the same house as those who are not infected?
Well, it seems like a simple question at first, I guess. The easy answer would be no. If you're infected, you should try to be away from those that are infected. But I think in life, it doesn't work out that well sometimes. So you may find that you have to be in a house with someone that's infected. If that is the case, sequestering as best you can with the resources you have is important. Avoiding sharing cups and spoons and then wiping down countertops and things along those lines is kind of the best that we have to offer for someone that finds himself in that situation.
Yeah, and as best you can, you just try to maintain that 6 feet or 10 feet of space inside your house.
Absolutely.
All right. Another question. What steps do you recommend for people to take to sanitize the homes once they are no longer infected with the virus?
Well, so I assume that the viewer is talking about someone who's had the virus,
right.
has recovered. I still think the appropriate steps of sanitizing your home are going to be similar to those that were before. If anyone were to come over, the virus could still potentially be living on countertops or other areas. The recommendations out there are pretty clear from the CDC and the Arkansas Department of Health about deep cleaning and again, sanitizing countertops and commonly used spaces.
All right. Jan sent in a text, how much of a hermit do I need? And my kids need to be, they're all driving me crazy. I know you're getting a lot of those questions today.
I do. And to Jan, I say we're with you. I think, I have 2 boys of my own, although I'll give my wife credit for all the work. But we're all with you. We're in this together. Maybe a power in numbers will help her a little bit, but you really do. You need to take the precautions. You need to stay at home. You need to avoid going out in groups. If you have to go to the grocery store in public, you need to send one person. And the answer is as best as you can.
Yeah. All right. One final thought from Dr. McGowan, and when we come back right after this break.